Hello everyone, my name is Jeff Hill. I'm the Executive Director of the Wilson County Substance Prevention Coalition. I'm honored and privileged to sit here with two of my fellow coworkers here today to talk about one of the initiatives we have here in Wilson County, which is called the Hope Alliance. Before we jump into too much detail with that, I'd like to give my colleagues a chance to introduce themselves. So Yolanda, I'll start with you.
Well, hello. My name is Yolanda Alston Foster, and I am the Office Administrator here at RC3. But most of all, I'm the North Carolina Certified Peer Support Specialist, and I work with this wonderful lady here beside me, Miss Shannon Nichols. And the main thing I get from my job is I have a passion for helping people because I have lived experiences, and I know how it feels to feel as though you're helpless and want somebody to just come and say it's going to be okay. Don't have shame, don't have guilt or fear. It's going to be okay. And so having 27 years in recovery, I still remember day one when I stepped in somewhere and I just asked them to help me. And I didn't know what kind of help I needed. I just knew I needed help. And I didn't know how the help was going to come. So I appreciate having this job because that's what I'm here for. I want to help people. And I want to be some kind of encouragement to people that are discouraged and going through pain. So that's me.
Thank you, Yolanda. Shannon?
Hey, I'm Shannon Nichols. I'm the Victim Assistance Coordinator at the Police Department. And in 2017, I became the Hope Alliance Coordinator as well.
Awesome. Thank you. So I guess the best thing to do is first to give a little bit of background about what the Hope Alliance actually is. So Shannon, do you want to kind of tell them a little bit about what it is that you guys do and kind of what that process looks like?
Okay. So if somebody comes in to the police department, they may call on the telephone. Most of them come into the police department. All they have to do is just tell the people at the front desk, you know, I need some help. They don't have to go into any details or anything like that. And they will call me and I will bring them back to my office. We have a room now that is set up kind of like a little living area, so they don't have to sit at a desk and feel like they're being interrogated or anything like that. And we just talk about what they have going on in their life. Most people come seeking detox or treatment, could be inpatient or outpatient, and we ask them a series of questions, like a little assessment, and from that, we try to help them determine what is the best avenue for them. And sometimes it's all completed in one day. Sometimes they want to think about our conversation and come back later to make the necessary steps to get them in detox and treatment.
Thank you. And Yolanda, do you want to talk about some of the roles that you played in the work you've done with the Hope Alliance?
Well, when they come into RC3, a lot of times they'll call first. But we have had 1 or 2 walk-ins. And when they come in the door, a lot of times, like I said before, they have no idea what help looks like. They just know they need some kind of help. And so when they come into the door, they see my face, and I'm there. And a lot of times people are nervous, they're anxious, they might be actively using, they have just used, and they're shameful, they feel guilt, a whole array of emotions and terror to some degree. They don't want to get arrested, they don't want this to happen and this to happen. So when they come in the door, the main thing I do is let them know that they're not alone. They made the choice to come in and get help or get resources. So don't worry about what occurred 5 seconds ago, a minute ago. That's in the past. We're dealing with the present and we're dealing with the here and now. And we're not here to judge them. and we provide them whatever resources they need. So, the first thing I say is, so tell me, what brought you in here? And they start talking, and we start talking, and then we try to get them resources, and then I reach out to Shannon, and let her know, their situation, and we work together to see what resources best suits that person.
Thank you. And my role is I'm behind the scenes. I kind of work around making sure that we have funding for the Hope Alliance. I work with the coordination of getting the checks to where they need to be. And then also, as the director of our coalition, I'm a big advocate of the work that we do and making sure that our community is aware and making sure that our access is equitable. The example I can give with that is that earlier this year, our Hope Alliance and RC3 RAC cards were printed in English and Spanish to ensure that our Spanish-speaking population within the county also had equitable access to our resources. So knowing a little bit about what the Hope Alliance is and how it works, the first thing that usually comes to mind, the question I get is, how in the world does that work with the police department? So Shannon, is there any chance you could tell us a little bit about that relationship and how that kind of came about?
Yeah, so, most law enforcement agencies across the state and country have realized you cannot arrest your way out of this. There was a lot of conversation about, having it housed in the police department. A lot of people were concerned that people would be afraid to come into the police department, especially if they have had prior, experience with us. But after we started this in the fall of 2017, and I might can recall maybe one person that on the phone indicated that they were concerned about that. I can come here and meet with them. We've done it several times. So I let them know that if that is a factor, we can meet elsewhere, but it's really not been a big concern at all. We do have some people that thinks, you know, it's just a police department program and they feel like they have to have prior law enforcement involvement, and I tell them no. Anybody that hears about it, we've had people from Roanoke Rapids, we've had people from Greenville that have heard about it and have come in. So it's just anybody that that needs it. We did have to have a conversation about if someone does have warrants on them, because being a police department employee, you know, we do have a policy that if they have a warrant, it has to be served. Also, if people are seeking treatment and they have pending court dates, that can also be an issue. But I always tell people, don't get excited, you can still go. There are ways to work around that. So a lot of the attorneys in Wilson are familiar with the program, because I've had to call them and say, hey, you know, your client is in my office and they've got a court date, you know, this date, this date. We really need them to go to treatment. And a lot of times they can postpone those court dates while they're in treatment. I've had a couple that went to long-term treatment and those court dates could not be put off for a year. So we worked it out where they could come back to court and go back that same day. But if somebody comes in and they do have a warrant, I can't ignore it. I have to have a conversation with them. And if they do go into treatment, we hold that warrant until they come out. I obviously will know when their discharge date is, because I am a part of the discharge process. And, you know, I let them know when you come out, you know, you need to come see me, and we'll get it taken care of then. And that, a lot of times, looks good on their part, that while they were, you know, waiting for court or whatever, that they took that active step to get help. We've only had just a few people that were in that situation, and it went well.
Thank you. Yolanda, so a question I have for you is, I know that you were very involved and ingrained in the community here in Wilson, in more ways just than RC3.
Yes.
I don't think you've ever met a stranger, if I'm being completely honest. So tell me, in your opinion, or just in your context, what do you think divergent programming, I guess if we want to call it that, or a program like the Hope Alliance, what kind of impact do you think that makes on our community at large?
I think it makes a tremendous impact. I think back in the 90s, years and years ago, when I was seeking recovery. I was homeless, I was addicted, and I had a criminal record. And I went into the actual police department in order to get help. So it wasn't a program like this. And the first thing the sergeant at the desk told me, he said, well, what have you been doing? Because I'm looking at you and it appears that you need to be locked up. So what did I do? I turned around and I left right out. And so Lisa say I got caught doing some criminal activity because I was homeless, I was hungry, I was addicted. So what was I gonna do? Some criminal activity. And so I got caught. I went to drug court. And when I went to drug court, the judge told me, he looked at me and he told me, he said, this is the third time you've been in here. And he said, I'm looking at you. He said, I'm looking at you. You really want to get help. I said, yes, sir. I said, I went into the police department and the first thing they told me was they were going to lock me up. I was going to do 6, 7 months to a year. So I turned around and I ran out. I literally ran out. And so he said, this is what I'm going to do for you. We're going to get you some help. We're going to get you in a program. We're going to get you detox. We're going to get you some resources. And because it wasn't just the addiction to the drugs. I was having problems with depression. The depression led me to the addiction with the drugs. It led me to being homeless. It was a revolving cycle. So I feel as though if there was a program years and years ago, like the Hope Alliance, that didn't judge, people can come and wouldn't have to be bound down by shame and feeling like they had chains around them. They could not be themselves, and they can just come and be relatable, have people that can relate to them, that a lot of people wouldn't have died. They did. And so I get emotional about it because I have 2 people that are dead now because they couldn't get off of drugs. And I have several that are in prison, and I have 27 years in recovery, and they've been in prison for a good portion of that, 20, 25 years, for serious crimes. So I'm just going to say, I thank God. I'm grateful. And just as long as I'm breathing, I have hope. So regardless of whatever comes my way, I just have hope. And so the Hope Alliance is about hope.
Thank you, Yolanda. The big thing with the Hope Alliance as well is that the Hope Alliance also helps us to contradict and counteract stigma within our community. And in a second, Shannon, I'll ask you to kind of talk about the many partners that are involved in this and so many people that sit at the table. But the other piece is we have to give so much credit to our law enforcement in the county for taking this active position on community policing, for looking at divergent programming in this way. And not only that, but not only supporting it, but being an integral part of it. Because the fact that law enforcement sits at the table alone sets aside and destroys some of the stigma that's associated with that law enforcement piece and addiction. But Shannon, if you don't mind, just talking about some of the partners that we have that sit at the table that really make this thing go.
Okay. We definitely could not do it without the community partners. As Jeff mentioned earlier, the police department, they just provide a staff person. All the funding comes from community partners. A lot of it from the coalition. The health department is a big part of, community resource that we use. The coalition has several grants, and I'm not sure if you're gonna talk about any of that, but, that we can tap into to help people get, the treatment that they need. Also, social services, DSS, East Point, the health department, I think I've already mentioned. A lot of the, not just in Wilson, but in surrounding counties and all across the state, partnerships that we have with detox centers and inpatient and outpatient treatment centers. Sometimes we have people that are from Wilson County and they are doing outpatient treatment, but they're doing it in another county for a variety of reasons. And it's very successful. Sometimes, depending on the situation, treatment in our area for a particular person may not be the wise decision. Sometimes they need to be in another location. And so you have to think outside of the box. How can we make this work? And I'll just share a quick example. We had a young man that really wanted inpatient treatment. He had been in a car accident and he had a lot of medical issues. And so we do not have inpatient treatment in Wilson. And the doctor would not give him permission to go far away due to the injuries he had sustained. And some of the treatment programs, some of the things that it would entail, some of them have work duty and that kind of thing. And so we talked about outpatient. And he was just concerned doing outpatient and having a lot of free time and being in the area where he bought drugs and that kind of thing. So we looked to doing outpatient in another county. But depending on your insurance and Medicaid and that kind of thing, sometimes you have to live in that county. Some programs do not accept people out of county, even if you could pay cash for it. So you have to look at all of that. So I was determined that this was not going to beat me and that I was going to figure out a way that this young man would get the help he needed. And we were just having a conversation with his parents one day, and they were talking, and I was listening, even though they weren't talking to me, and I said, "Did you say you had a mountain home?" And they're like, "Yes." I said, "Well, what county?" And so I sat at the computer and I started looking up stuff, and I started making phone calls, and I said, "By any chance, can he go stay there for a while?" And make a long story short, the entire family went that way, and he completed his outpatient treatment. They're still there 2 years later, and is doing extremely well. Sometimes people do well coming back into the community. Sometimes it's better options for them to be elsewhere. And that was the case for him. So sometimes you have to think outside of the box. But when we work with partners in other counties, I always tell them, share my information with the people you come in contact with. And just the other day, I had a gentleman that I needed to get him some help in another county, and I just made a phone call, and it was done in less than an hour. And so there's no way I can know everybody, but if I know a lot of people throughout the state, then I can contact them, and they can put me in connection with the people I need to be in. So we have a tremendous group of people that we work with, and we work so well with them. We call each other sometimes at night, and a lot of the inpatient treatment places have made us a part of the discharge plan, and so this person's discharge plan that's from Wilson that did not go through Hope Alliance, they'll have all these things listed. The ones that come through Hope Alliance, it'll say, contact Shannon Nichols when you return to Wilson. So they come to me and I have a packet and we go through that. And of course, RC3 and a lot of the things that go on in this building are a part of that. But collaboration, and we just couldn't do it without all of the partners.
Thank you. So Yolanda, I have another question for you. So you recently put together some community resource packets, since we're on the subject. Tell me a little bit about what those community resource packets have in them and how we plan to use them with our Hope Alliance clients.
I'm glad you asked. The resource packages are mainly for individuals that come in and they're not quite sure exactly if they want to go to detox or if they want to sit down and speak with someone, or perhaps they're trying to find an NA meeting or AA meeting and they're not sure what meetings. We have a resource packet that has a Hope Alliance rat card in it, a RC3 rat card, Jeff's business card, and it has a calendar of events for RC3, but most of all, it has the meetings, the AA meetings, coordinate in a chronological order as far as Sunday through Saturday. So the dates and the times, and also the locations, and if it's a closed or open meeting. So they would have all the resources they would need in order to find a meeting. If the meeting is not here or if it's not convenient for them, they can find a meeting, they can find resources. It even has inpatient and outpatient facilities in there, contact numbers. So it's a valuable resource for those that are just coming in, because sometimes they come in and they say, well, I don't want to talk to anybody. I don't want to schedule an appointment. I just want to know where a meeting is. And so I can give them a packet and it has all the information in it. I actually gave one of those packets to the plumber. He came to fix fix something in the bathroom. And he asked me, he said, by the way, what is this place? And I said, I'm glad you asked. And then I opened my drawer and I got one of the resource packages out. And he was telling me about someone he knew. And so I went through the resource package and was telling him about Hope Alliance and everything and gave him the packet. So they're very useful.
Awesome, thank you. So now I guess it's my turn to talk about a little bit more of the administrative top-down piece as far as funding, allocations, and other things are concerned, because obviously these things aren't free to do. But when you have a community like we do here in Wilson with partners that are willing to not only sit at your table, but to put into the pot, it makes life a lot easier. So from our perspective with the coalition, there's two different funding pots that we pull from, with a third if need be. We've been awarded federal funding to support this, we've been awarded state funding that allows us to support this, and we have localized funding that allows us to support this. So when we talk constantly about our funding streams, that's all three levels that are allowing us to do the work that we need to do. Now, again, piece of that is the fact that we have a Shannon Nichols and we have a Yolanda Austin Foster that is here to really not only support this work, but to drive it home. And now is my opportunity to brag on them, because the other piece of this is they're building these relationships, as Shannon stated earlier. We have different facilities and different other organizations that have taken note. And they're not going to tell you these things, so it's my job to do so. But last January, the first example I'll give you before COVID was a coworker of mine and I went to New Bern for a conference. And I sat across from somebody and she saw my name tag and asked me if I was familiar with the Hope Alliance. And I said, yes ma'am. I said, technically it's part of what I oversee. I said, but just Shannon tells me what to do and when to be there. She said, well, I don't know if she's told you this. She said, but I've actually worked with Shannon around a client who ran into some barriers as far as being able to get them into our facility. And she said, I just want you to know that we offered the first and only full scholarship we've ever offered. And we plan to work with her, and we would love to have her continue her sobriety and her work here with us after the fact. And then a few weeks ago, on the other side of the state, we were actually approached by a treatment facility who came to Wilson to meet with us, to see our facility and to talk about the work we do. And because of all the hard work that these ladies have done and our partners have poured into this, we actually now have the opportunity to send 3 uninsured community members to full inpatient treatment at no cost every year. Only thing that we are responsible for is the follow-up care, which we already have a plan identified for on the back end. So that just shows anybody that's watching this that if little old Wilson can do it, anybody can. And if you work hard enough and you have the right people in these positions, like a Shannon and a Yolanda, then the sky is the limit. Away from that, the other thing that this does is it again addresses stigma, and I'm going to harp back to that because one thing that we've discussed before is that the Hope Alliance gives people a private way to seek resources. And what I mean by that is there is still in a rural community a stigma with the closed door conversation where if I'm suffering from a substance use disorder, I can't talk about it because for lack of better terms, it affects my reputation and my family's reputation. Or my family doesn't want me to have this conversation because XYZ from the church doesn't need to know what I'm doing. Thankfully, those types of things are beginning to deteriorate thanks to a lot of work of a lot of people around this county. But the Hope Alliance also gives people an access point that you could be walking into the police department to apply for a parade route. There isn't anybody that needs to know why you're there. And Shannon does a tremendous job of making it just as casual and as private as it needs to be. Truthfully, Shannon, you and Yolanda are the heart and soul of this. And I don't think anybody else would tell me anything differently. What I can tell you is that as the director of this coalition, the Hope Alliance is not just an initiative, it's a priority. When we talk about our work here in the county, we again started as a prevention primary focused organization back in 2007. And thanks to our former director, Aaron Day, and a group of teams called the Recovery Team, we really identified that recovery and treatment were high profile needs and high barriers within our county. And so in reality, the Hope Alliance in and of itself became something that I inherited, I didn't start. But since I've been here, I've been able to see the changes that these ladies have expressed in our community members that have gone through. I see the relationships they're building. I hear these wonderful stories of people that are in recovery, whether they be in Wilson or out of Wilson. And the fact is now is that it's amazing to see that we have other places that are coming and asking us about this program and the way that it's structured. Because in truthfulness, when we started it, even though I wasn't here, I know that we had to ask for help from a neighboring county. So the biggest thing I guess that I can say in regards to that is it is truthfully not only a community effort, but it's a statewide, it's more than that. Everybody plays a role, no matter who you are, where you come from. And the other piece is that if you're interested, you always have a seat at our table. So is there any?
Overlooked the thing, in my opinion.
The only thing else that I will add, if anybody thinks that this is a 8 to 5 job, it's not, because like I said earlier, sometimes people come in, they know what they want, they get it done. Sometimes you talk to people numerous times before they're ready. Have a young man, he's on his 3rd week inpatient treatment. I have talked to him for 2 years. We have overdosed, we have done it all. And I would always tell him, I'm not giving up on you. And about 3 weeks ago, this time, he called me, not Mom. And I said, oh, we might be ready. He came, and it was a different person than all the other times that we had talked. And he is doing great. His mom still cannot believe he's there, but I've assured her I check on him, he's there. And so, you know, sometimes it takes a long time. But until that person is ready, you can't push it. It's not going to work. They have to be ready. And I wished that I could make a lot of mamas happy when they come in, but it just don't happen that way. And sometimes, you have to meet them where they're at. And if it's on a Saturday afternoon, it's on a Saturday afternoon. You don't go to detox just Monday through Friday. You might go at 7 o'clock on Sunday morning. And so, you know, you just have to be flexible and willing to help them whenever it falls, because you just never know when it's going to be.
So can you explain the logo with the pinwheel? Anybody?
So I can talk about the pinwheel, and then if you want to talk about the logo design. So the pinwheel originally came from RC3. It was designed, obviously, to show the different colors and different aspects of the recovery process, and to also show that it's kind of, it truly looks like a continuum, for lack of better terms. And so when we did the design for the Hope Alliance, one with an O and a pinwheel, it was a pretty legitimate fit, but it also shows a continuum between RC3 and the Hope Alliance with that treatment and recovery piece. And is there anything that you want to add to that? I mean,
That's it.
I didn't even know that.
When she started asking her question, I was thinking about how we came up with RC3, the
Yeah.
name. But then I thought, that's not what she just asked, so,
And
yeah,
I
you
know
answered
that-
it good.
And I knew the story of the pinwheel, but I think it's really helpful.
Yeah,
Yeah.
well, and the
Yeah.
other piece to add with that is that you want to make sure that hope is a big piece of it. It's obviously the most forefront thing there, and the alliance shows that it's an alliance of community members. It's people there for support.
So this is more than just a referral program. You know, it's not, hey, I need help, what do I do? Oh, well, let me give you this phone number, or let me sit with you for 30 minutes of case management and call somebody. It's much, much bigger than that. What makes this different from me calling 211 or anything like that?
We walk them through the whole process. A lot of people come in and they say, we've tried this on our own, and we don't get people to return our phone calls. You know, we're confused as to what we're supposed to be doing or whatever, and they just get frustrated. And they come in and we do our little assessment, we have our conversation. If they're ready to go ahead, we go ahead. And if they come in and they have an appointment, I block off 2 hours. It may not take 2 hours, but a lot of times it does. And so if they need to go to detox, we go ahead and contact detox, and that depends on what kind of insurance they have and that kind of thing. And, you know, with COVID and everything, detox everywhere's kind of backed up. So you have to build those relationships, and it will help not to be in such a long line. But we have like 4 different places that are just strictly detox. Now, some of the inpatient treatment has their own detox, and so they can just go there. The thing with detox, if you go somewhere, I'm just going to use Port for an example. If you go there, they're strictly detox. So the inpatient treatment, you have to coordinate it, because treatment wants you to come straight from detox and don't stop except for maybe to go to the bathroom one time and keep on getting it. And so you have to, if we have a 2-day wait for detox, then I have to have them somewhere to go during that time. And so we make sure once we have the detox bed, we know they're going to be there roughly 7 days. So then we make sure that we have their bed lined up for treatment. And I never tell somebody, you have to go here. Based on what they tell me when we have our conversation, and some of that conversation is around mental health as well, and then things that they like. You know, you don't want to go to the mountains if you really, really hate the mountains. That makes no sense. And so after we look at all that, I kind of think and figure out what places do I think can best meet their needs. Some treatment places have more medical staff than others. So if you're going to need that, then there's no need of looking at these places over here, because they don't have that. And so I usually pick around 3 places that I think would meet their needs. And I have brochures and I have all kinds of things from all these treatment facilities, and I will give them to them. I also will pull them around to the desk and we'll pull it up on the computer and we'll go through what the rooms look like, where they're gonna be staying and this kind of thing. They make the final decision, this is my first choice, this is my second choice. Sometimes we have all that lined up before they go into detox. Sometimes they go into detox and we have to finish that. If the treatment center has time while they're in my office to do the phone interview, they do it right there, because we know it all got done. And it just, when they leave, they don't have to worry about anything, other than, you know, do you have the things that you need to bring? And if they don't, it's okay, because we have community partners that can provide that to them. One other thing that I forgot to mention earlier, this funding is flexible funding, so most of it is used to pay for treatment, transportation, and detox. There's also some funding to help when they come back, to help them remain in recovery. And if you've been in treatment for 60 days, and you either weren't working or you lost your job because you went to treatment, you have a light bill to pay when you come back, and you have this and you have that. And sometimes it's kind of hard to do that when you come out and you're trying to find a job and you're trying to go to meetings and you're trying to do all this. So if that is a burden, then some of the funding can be used for that. We're very careful with that. We don't just hand money to people, you know. Paid somebody's rent one time. They provided me with a copy. They didn't get an invoice every month, but they provided me with a copy of their lease agreement. So it had that on there. We've assisted with light bills, that kind of thing.
Can I add something to that we overlooked? It's the people that make the difference. It's these two right here
Yeah.
that make the biggest difference. It's one thing to call somebody and talk to them over the phone, but to be able to sit down with somebody that you can tell genuinely cares about you, that's what makes the difference, and that's what makes people so accepting of what they're offering. Because knowing people that have gone through it, having family that have gone through it, walking through that process prior to being here with people, this is a totally different ballgame. And the other thing is that it makes it easier for people to say yes. And that's one of the biggest keys to all of this.
I mean, you talk about relationship building, but it's not just the Hope Alliance's relationship building, it's you guys. That's completely different. You know, if you have somebody else in that position and they're making that phone call, they're not gonna get as many yeses as you are, because you're really sweet. But I have a sense you're feisty, but I mean, I think you're, you know.
I can be.
I have no doubt of that one. So how easy do you think it would be to replicate this model in other counties, especially if you already have like a statewide alliance and connections and names? Could this work elsewhere if you had the funding?
I think it certainly could. I'll be honest, our motto was mimicked from Nash County with the Hope Initiative originally. We reached out to them, and really our manual is almost a carbon copy of what they used. For us, it was really the funding piece, making sure that it was available, ensuring that we did have that equitable access piece in place. But the other thing to keep in mind is that you don't have to send 100 people in a year. You have to have a starting point. So what we say is, like, for instance, we are funded by our healthcare foundation, and they give us $12,000. They gave us $12,000 this year, which seems like a lot of money, but that's 5 or 6 people. But the fact is that last year it was $9,500. This year it's $12,000. Next year it could be 15 or 20. It's all dependent on showing the proper use of the funding and showing the need. And just getting a baseline start allows you to do that. And I can tell you that now more than ever, especially coming out of this pandemic, there are people and there are different pots that are more than willing to allow you to dip into it for things such as treatment, detox, and other resource accesses. So absolutely, if we can do this, anybody can. I truly believe it.
I bogarted all the questions.
I got one. How do you guys advertise, or is it just word of mouth?
So we advertise in a couple of different ways, and if I miss anything, just let me know. So there's not many places in Wilson that provide a service or a community level service that you're not gonna find a Hope Alliance rat card. We want them available anywhere and everywhere that will take them, and that goes all the way from the police department to the senior center and the pregnancy center, because you never know who's gonna need it. We also do mobile billboard advertising in the past. We've done some advertising, especially when we started in the paper, to let people know that this was available. And then the other biggest thing is that, again, you already have a group of key community stakeholders and partners that are at the table. So as they're having conversations at a DSS or a health department, it becomes part of that case management plan. To where if substance use disorder comes up, the first thing is, can we refer them to the Hope Alliance? Is there a way that we can get them in through that? Because again, some people do come through and that funding piece is taken care of. They just need the help finding the resource. So some of it is word of mouth. We are rural, we are local, especially in our rural areas of the county. That word of mouth plays a big factor. Community resource guides make a factor. And then with our post-overdose response team, anybody that is seen for a port visit or for an overdose call receives a kit that has Hope Alliance information inside of it. So that way, if they do make that call, the treatment is right and it is a possibility, they have the contact information right there and ready, and it fits inside a wallet. So it's something that can be hidden, and it's not everybody else's common ear knowledge.
And at the police department, when new officers are hired, they have to go through orientation training. And so they come to me for victim assistance and for Hope Alliance training. So they all know where the rat cards are, they all know how the program works, and if they come in contact with somebody, not just at an overdose, but if they go into a home and there's a lot going on, and in conversation it comes up that somebody is using or something like that, then they can, run out to their car, leave a rat card, or give them my card and, say you might want to call her or whatever. So we do train all of our officers as well.
Love that. We're huge fans of wallet cards. We use those all the time for crisis and everything else, and they're easy to stick in there and no one knows they're there. I think it's great. Do you guys have any more?
I'm good.
Yeah. Do you guys have any questions? Ashley, want to? I'm just kidding.
Can I just add one more
They
thing?
don't have no
Just
questions.
How many times have you said that today?
Probably 7 or 8. I just want to say, and this is coming from working here and then working in a role prior, this service is invaluable to our community, because when you think about treatment in general, the first thing that comes to mind, even now working in this field, is the cost. Because the other piece of the puzzle is that insurance, depending on what kind of plan you're on, it may be covered, it may not be. The mental health aspect may be, but the behavioral piece may not be. Having a resource like the Hope Alliance, one, makes it easy to access, but two, it's so great to have somebody that knows this and can walk you through that process. It creates a level of comfort. And you also have to keep in mind that some of these people, especially those, because we deal with the homeless population and other populations of the county, it's not a segregate piece of what we're dealing with. It is anybody and everybody in the community. They may not have had somebody that sat down with them and told them that they cared about them in a long time. Especially somebody that they can tell means it. And having that type of resource for that type of conversation leads to a lot more yeses. And it leads to a lot more people recovering. And it leads to a lot more people living in sobriety instead of vice versa. So to me, as much as I love prevention and I love recovery, this is possibly the most important thing that we are a part of in the county, because in truthfulness, we are saving lives one day at a time. Excuse me, y'all are saving lives one day at a time.
What?